Carcinoma of the ovary is the most deadly of all the gynecologic cancers. Those little ovaries, they're hidden deep in the pelvis, and tumours can get quite big before they're noticed. Imagine if a breast cancer was the size of a softball before it got noticed. The reason why ovarian cancer does so badly is it stays hidden for a long time. The ovary is a complex organ. It has lots of cell types in it, and all these cell types can give rise to tumours. The most common source of tumours is the epithelium that covers the surface of the ovary and forms little inclusion cysts. The bad cells in this epithelium actually often come from the fallopian tube, which rains cells like snow down onto the surface of the ovary. It sticks in the tiny scars that are formed by corpus luteum and other small traumas to the ovarian surface, and then grows and can become cancer. Sex-cord stromal tumours are really rare, and they arise from the cells on the outside of the follicle, the granulosa cells and thecal cells, as well as the fibrous tissue that makes up the ovary. These are the ones that produce hormones. The normal function of a granulosa cell is to produce hormones, so that tumours can produce hormones as well. Germ cell tumours. There's one common one, the dermoid cyst, which we pathologists call the benign cystic teratoma. The rest, they're really rare, and you probably don't need to know about. So here's some key concepts for epithelial tumours of the ovary. Most ovarian cysts are benign, but malignancy must always be excluded. The risk of malignancy increases with age, and increased serum CA125, and the finding of solid areas on an ultrasound scan. These are the investigations that must be done for any woman with an ovarian mass. There are 3 degrees of malignancy in surface epithelial tumours. They can be absolutely benign, they can be of kind of indeterminate malignancy, which we call borderline, or they can be malignant. Fortunately, malignant tumours are the least common. The surface epithelial tumours can be lined by a variety of epithelial types. The most common are serous cells resembling the fallopian tube, and the second most common is mucinous cells resembling the cervix. I always think of surface epithelial tumours as having an email address. If you look at each of the names of them, and they are quite complicated, you will notice that they kind of have a first name and a second name. So their address is firstname.secondname@ovary.com. The first name describes the type of epithelium lining the cyst, and the second name describes how malignant they are. So if their second name is cystadenoma, it means they're benign. And if their second name involves the word carcinoma, then they're malignant. And the ones in the middle, we just tack on borderline malignancy. So we know, for example, a mucinous carcinoma is going to have mucinous cells in it and is going to be malignant. This is a picture of a serous cystadenoma. Now it looks like a water-filled balloon, and essentially it is a water-filled balloon. Sometimes there are lots of little balloons clumped together, and we call those locules. But notice how thin the walls of the locules are. There are no solid areas. This is typical of a benign ovarian tumour. Completely cystic, no solid areas. The previous serous cystadenoma would have been lined by a single layer of epithelial cells that are quiet and not replicating. But look what's happening in this serous borderline tumour. Now we're getting papillae and lots of cell replication. This tumour has some oncogenes activated. That's telling it to replicate. It's more complicated, but it's not invading the stroma. This picture of serous carcinoma is vastly different to the serous cystadenoma that we saw. Look how complicated it is. Look at all those solid bits. Solid is bad in an ultrasound of epithelial tumours of the ovary. What we can also see incidentally in this picture is that yellow ring. That's a normal corpus luteum in the ovary. The difference between borderline tumours and carcinomas is the presence of invasion. This is a serous carcinoma which has invaded. We now have little groups of cells spreading through that ovarian stroma out to the surface and then around the abdomen. These are the key words when describing serous carcinoma. Papillae, remember, they're the things that are finger-like with epithelium over the top. If they're cut crossways, then they resemble circles with epithelium around the outside. Also distinctive are those purple blobs. The name of those purple blobs is psammoma bodies. They're little blobs of calcium that form in tumours that have papillae in them, and they're typical for serous carcinoma. Epithelial tumours occur in older women. They're most common in women over the age of 70. In contrast, ovarian germ cell tumours occur in young women. The commonest kind is the dermoid cyst or benign cystic teratoma. It's seen in women often in their 20s. There are other ovarian germ cell tumours. They occur in girls and they can be malignant, but they're so rare that we aren't going to learn about them here. This is a benign cystic teratoma. Boy, are they weird tumours. They arise from germ cells, which means they have the potential to form lots and lots of tissues. Most commonly, they have hair in the middle, dark black, smelly hair, surrounded by a whole lot of white gunk, which is keratin that's being produced by the squamous cells lining the cysts that form them up. When these are taken out, we get them in the lab and they have a characteristic doughy appearance. We then stand well back while we slice them open. Down the microscope, they're much more fascinating. We can see cartilage and brain tissue and thyroid and intestinal tissue, anything you can imagine, even teeth in these benign cystic teratomas. These are the key concepts I want you to take away. Most ovarian cysts are benign, but malignancy must always be excluded. Investigation must occur to exclude malignancy. And the cornerstone of investigation is CA125 and an ultrasound scan. The risk of malignancy increases with age. So if an older woman presents with vague abnormal feelings in her pelvis, it's important that she has investigations and an examination to exclude ovarian cancer as early as possible.